Esteemed guest on here. There's a couple of things on the live read sheet that you want to clear out of here, sir. Join SuperTalk Mississippi and Mississippi Blood Services. Where?
They're going to be in Flowood on Lakeland Drive tomorrow from 10 to 1. You know, with the pandemic, blood supplies are at very low levels, so donate blood today and save a life. Go to msblood.com to learn more.
Roll up your sleeve and then catch the JT Show with Dave Hughes. Going to be live at Corner Market Food Store in Hattiesburg, and that is going to be on Friday at the annual Corner Market SuperTalk Mississippi Christmas Toy and Food Drive. We'll be thinking about JT all that time because that's just a regular staple for him.
He always brought a lot of canned goods in and a lot of toys from listeners.
And I'll bet you the app is on and he's going to be listening to it.
Probably so.
In Houston. And if you want to make a difference this holiday season, one simple thing you can do is shop local. The pandemic has hurt so many small businesses out there. We need your help. And I from what I gather and I hear, a lot of people are doing that and making an effort to do so. Shop your local hospital. I don't think we have a problem with that.
Right now, we do not have a problem with that, Paul.
The hospital business is about all we can handle. Tim Moore, President and CEO, Mississippi Hospital Association, sporting his November beard again. I think this is permanent now, isn't it?
Well, it's about 2 years.
I was going to say, this is it. You can't take it off now.
It's getting close. It's getting close time to come off. So we'll have to trim it back a little.
The speaker was in the other day, and his looks. Did you see that? Looks good.
I heard him. I didn't get to see him. I heard him on the radio.
Well, I think a salt and pepper beard looks good.
Well, I've got more salt these days than
I say that because there's nothing you can do about it anyway. But
that's right.
Do a little paint over, but it's not going to stay that way. How are you doing? The family doing okay?
I'm doing good.
Have you stayed COVID-free?
You know, we have. We've been very fortunate, Paul, and I'm very thankful for that.
Yeah.
We've stayed in. We've tried to be as mindful of restrictions as we could.
Let me ask you this, though. Looking at the overall, how are we handling that as far as all of your members across the state that are members of the Hospital Association? How are they holding up?
Right now, Paul, it's tough. They are struggling. I don't know of any that are not. The numbers
struggling physically or financially or both?
You could say both. Emotionally, you think about this. This thing really kicked off and started taking off in March of last year, and now we're at the end of the year.
March of this year.
Excuse me. Yeah, I hadn't crossed.
Don't be doing that.
The year. It seems like it should be gone. I'm ready for 2021.
I know.
But our nurses and our providers have been facing this every day since it first hit, and we saw great peaks go up, and then we implemented some things like a statewide mask mandate, and we saw the numbers come down, and then now they're just going through the roof. And we knew it was going to happen. I'm afraid it was going to happen. Yep. Thanksgiving holidays, and my fear is, and we were just talking about this, Christmas. That's the time that all of our families want to get together, and I plead with folks right now, and we're definitely taking extra precautions with our family not to get together like we always have. And if you do, the distance is there. But, when we start bringing families together at Christmas, we bring them from all over the state, country, and you don't know what's coming.
Age groups. Because you got kids from college coming in. You got the high school kids coming in. You got so many different people that have been
just total
it's
exposure.
Almost impossible. Yeah. To even with the test now, because you can test somebody on Wednesday and Thursday, they'll be out at a Christmas gathering, and you never know. But you got to look at it. Every third person you bump into now has probably got carrying the virus.
And y'all may have talked about this as well, but Charlie Pride. They were talking about CMA was getting all upset because they thought he got it at CMA. Well, he was negative before he went and negative when he got back, so it happened somewhere else.
So you never know.
Can I give you a real positive thing on Charlie Pride?
Yeah.
Charlie Pride, I don't know if you know this or not, Paul, I was involved very deeply with Jimmy Rogers when I was in Meridian. Matter of fact, president of the foundation for a couple of years. Charlie Pride, great Mississippian, when he came and did a show at Jimmy Rogers, as far as I know, he never kept the payment for any of those shows. He donated it back to the Jimmy Rogers Foundation. And a lot of folks don't know that.
Yeah.
Matter of fact, I doubt many know that. But just to say a thank you to him and his family for what they've done for
He's going to be missed. Anytime he was invited back to Mississippi, he would come back.
He was a great guy. Great guy.
He was an unusual. We talked about this yesterday with our brother in broadcast, Steve Azar, and he was unusual in many different his emotions, the way he perceived and the music business itself. He was so comfortable in country music that it was a no-brainer for him.
Absolutely, and as humble as he could be.
Yeah, he's a good baseball player.
Take you off another way.
Well, here's the thing: we're glad that he didn't get picked up and make good as far as baseball.
That's exactly right.
Because we'd lost a lot of good music. Yeah. Back to the matters at hand as far as the vaccine. Yeah. What's the status of that? And we have any idea how soon that's going to be maybe ramped up or completed?
Of course, it's being ramped up now. We actually had some hospitals receive vaccine yesterday. Mm-hmm. There'll be a number of more that'll pick it up today. And as soon as it gets there, the process starts. Getting as many of our healthcare workers vaccinated as soon as possible is going to be a real important part of what we do going forward. We got to protect our frontline folks because there's so few of them.
The Mississippi received an initial batch of 25,000 doses of vaccine. This is the Pfizer vaccine.
Correct.
That means is that 25,000 split in half because they got to take two, or is it 25,000 doses?
It's my understanding that we're going to get 25,000 now, and then in 3 weeks we get another 25,000.
But that's the same folks?
That's the same folks.
So it's going to take 50,000 doses
to do the first run.
To do the 25,000 people.
Right. Which is not quite half of the healthcare providers just in hospitals alone.
So there's 50,000 hospital.
Almost 60.
Almost 60 across the state.
The numbers have actually come down.
What's the category? Is it doctors, nurses, and administration too?
I guess administration would be counted in that, but there's a lot fewer of those. When we start talking about the biggest number, it's going to be nurses, and then you start looking at the technical aspects, the lab folks, the respiratory folks.
Is that inclusive of, let's say, a UMMC?
It is.
So about 60,000.
About 60,000.
State health officers said the vaccine came at a vital time for Mississippi as corona hospitalizations are reaching record highs. And again, as I mentioned earlier, we had 1,648 new cases yesterday, 5 additional deaths. And the graphs, I always look at that graph. That graph shows new records for hospitalized patients, confirmed with COVID, patients in ICUs, and also those on ventilators. But slowing the outbreaks in long-term care facilities is also a priority. There are 213 current outbreaks in our long-term care facilities. And as we were talking yesterday with Stacy Pickering as far as the veterans' homes, it's one of the first places that ought to have these.
Absolutely.
The healthcare workers
and
there.
it is. The patients. And they are number one on the list. They're coming right in behind them. That's a joint project between Walgreens and CVS to handle the nursing homes.
How long do you think it's going to be? Maybe spring, late spring, where it's going to be like a flu shot? It's going to be at CVS or Walgreens or someplace like that?
Paul, I'm just hoping that we can get everybody that wants it vaccinated by the 1st of June.
This is going to be a little bit different than the flu vaccine because as all of this rolls in, you're going to have some options which one you want to take. Do you want to come in for 2 from Pfizer, or do you want to go with the Moderna? Moderna.
Right.
Do you want to go that one, and it's only going to be one?
Well, it's two also.
Oh, I didn't know that.
Moderna is. I think Johnson & Johnson may be working on one that's a one-shot. But
so the Moderna is also. Is it the same lapse of time in between?
It's a little bit longer, I think. I think it's 29 days or so or something like that, and the other one's 27. That may not be exactly right, but it's close.
Yeah. So there's a third one out there, too, and that was what?
There is. And I cannot tell you, Johnson & Johnson, there's about 4 or 5 that are moving forward.
Yeah.
But the Moderna and, of course, the Pfizer have been.
Well, I'd guess the same places like a Walgreens would have all 3, and then you've got to be up to speed on exactly
what you want to do.
And I don't know how we do that unless we have some collective data that says, okay, here's the data on the after effects. And with social media, I'm sure that's going to be storming out there.
It's out there. It's on the Department of Health website now. But I tell you, one of the big things is going to be the stabilization of the product. The Pfizer product is much more unstable.
That's the only one.
And that's the one
that's going to be like 85, 95 degrees below zero.
Below zero. Yep. It's an interesting project.
And they're ready. Apparently, in where we're putting it, we're ready for that. Is it kept on liquiid nitrogen, or is it?
It's dry ice. Yeah.
Does anybody use that for other things like putting a couple of popsicles or other?
I hope not.
I use it for my magic show that
or either that or stick a couple of cold beers in there. I mean, come on, man. You don't want it to go to waste. More coming up in a moment or two with Tim Moore, President of CEO Mississippi Hospital Association. We'll talk legislative session also because it is almost /business. In the House, it's Tim Moore, the President and CEO of Mississippi Hospital Association. Session starts before you know it. And I think the overall view is, depending on what happens in January with COVID,
right,
probably gavel in, then maybe spend a day or two and then gavel back out and wait for this vaccination to at least.
That's what I understood.
And I think it's probably what's going to happen, unless something unforeseen, like everything goes down and we wonder where COVID went, which I don't think is going to happen. So your thoughts?
Yeah, and I think that's right, Paul. I've actually had some conversations with some of them about even trying to find larger venues to spread out in. Whether they go that direction or not, I don't know. But also, I think maybe taking action to be able to take a virtual vote. I mean, we've all had to go to Zoom meetings, and I don't like them. Okay, I hate the things, but and as we said earlier, it's nice to sit down and talk face to face with somebody this morning. Yeah. But I think in all precaution, if an emergency vote comes up, rather than take a chance at creating or spreading an illness, let's look at doing this on a Zoom meeting or some other type of product.
I think first and foremost, it could be done on committee meetings because it's a smaller scale without any problems at all by coming to Jackson and meeting in one room.
Right.
But I don't see where it couldn't be done.
I don't either. Well, they'd have to change the rules. They'd have to change the rules.
I understand that.
But they can do that.
But they have the ability to change the rules. But the other part of that, too, it would be savings to us as far as per diem and everything else, travel and all of that stuff. I understand that. But what would be even better is that you could handle business faster. You wouldn't worry too much about hacking or anything like that. This would be like mail-in voting or internet voting. This is different. You could handle most of what you're doing live and in person as far as Zoom is concerned.
And all these are the public meetings anyway, so you can still have the conversation. But, I mean, you can get as private a meeting as you want to on Zoom. So it
would be interesting because in the same way you probably could have people communicating with their state legislator or House or Senate at the same time on the computer. So
that's a good point.
All right, so where are we with some of the issues that you guys are going to be bringing up as far as the hospitals across the state?
Sure. Paul, and let's put the pandemic aside. Hospitals in the state of Mississippi were in trouble before that happened, and we've talked about that as many times as we've been on here. We've talked about the rising uncompensated care. If you look over the decade, just from 2010, our uncompensated care costs for hospitals, just hospitals, not outside, has up $350 million. Or $250 million, I'm sorry, somewhere between $250 and $300. That's just an unacceptable number for our hospitals to be able to.
It's up to that amount or up that amount?
It's up that amount, and what I'm talking about is actually a difference. Let me back up just a second. The number is actually up, cost, not charges. Remember charges, is up $600,000 now. So that's up $250,000, $300,000 from where it was in 2010. That's a major issue. We have been talking to the legislature constantly about that problem and trying to get some help. Of course, that's fallen on deaf ears, as we've seen. So that definitely will be a discussion that we will have to have because our hospitals can't continue to do that. With COVID on top of that and the shortage of personnel, healthcare personnel, whether that be doctors, nurses, or any of the others, we've got states around us that are coming in and basically just cannibalizing our staffs to bring them over to another state that has more money and the ability to pay higher rates. I had an individual tell me the other day that they had RNs that were going out of state making $115 an hour. That's pretty good money. Hospital, I don't care where they are, will not be able to sustain that. So at some point in time, there'll be a reckoning, and all that'll be shifted back to some degree. But, it's tough to raise somebody's income that much and then figure out how you're going to take it back.
Yeah. You and I have had this discussion, and I don't want to beat the horse to death on this one. But just as a layman out there, and I know I'm going to ask the question that a lot of the audience here is asking that same question. When you look at places like Lowe's or Walmart and in the businesses that have fared well during this pandemic, hospitals, if you are in the business of helping people, but you're also in the business of making money. So you set your prices and everything else. You get reimbursements from the federal government. Part of the CARES Act, you had some dollars coming in there. You also had a per-patient compensation as far as the COVID patients. Why aren't you making money? Why is the business model to the point where if you're a movie theater and you got every seat filled and you're still not making money, something's going wrong here, and I'm not trying to beat you up on this.
No, you're not.
It's just one of those questions we don't understand out there.
Sure, I understand.
The money's coming in. The federal government's making darn sure that you get that money. You got every bed filled. Where are you losing? Is your business plan wrong?
Well, let's back up and think about where the restrictions that were put on the money. Mm-hmm. In other words, the COVID money, all the CARES money could only be spent for certain things. So you still have all these costs over here that you got to pay for somehow. Okay, that's a separate one. Now we've got all these supply costs that have gone through the roof. The PPE and, well, anything in the healthcare now has just gone up tremendously, exponentially since this all took off. And it's a supply and demand type issue, okay? So your costs have gone through the roof, even though you've got money out here, and some of that money you can't spend.
So
on
in other
those
words,
things.
you were buying a mask for 23 cents, and now it's $2.30.
It's more like $4
for a mask.
Yeah,
and
instead of the 22 cents that you paid before COVID. Yes.
What's price gouging?
You would say that, yes. I would say that. Matter of fact, we had an opportunity to share that with some folks and see if hopefully something will happen. But, and it wasn't just masks. It went to shoe covers, to gowns, to sterile drapes, to all these things that are involved in the process. They went up. When we started looking at putting in negative pressure rooms, all those things went up because everybody in the country was wanting to start those and put in rooms to protect or take care of the COVID patients.
Explain that. That means that all the air from that room is not going into the other rooms.
It's complete exchange. In other words, you've got the air in that room changes out so many seconds. The volume is rated out, anything, but you have clean air in that room constantly. So many of even our small hospitals. Now, that money, COVID money, could be used to do that and spend that. But you can't make a profit on that. I mean, it's just you're providing a service you're going to need. So that's part of the issues. But the biggest one, though, Paul, is staff. And that's been our problem all along. It's not rooms. It's not physical space. It's staff to be able to do it. So when we started moving toward the need for nurses everywhere, the contract companies get very involved in that, and they start hiring nurses at a higher rate so they can go farm them out somewhere else. And it's not just nurses. It's respiratory therapists. It's all the healthcare providers. And those numbers start going up so dramatically that it is extremely difficult to make it work. So that's where the business that you have no control over.
Sidebar on that one, anybody listening out there in high school or just getting into high school, healthcare might be a good industry to get into in the future.
Well, I've always said that. I always said it's good. That's what my dad told me. I'd always have a job.
So where does this place the con issue, the certificate of need issue, going forward?
Sure. Well, Paul, you know where I am on that. Healthcare is not a free market. It doesn't work that way. And we've talked about that, and the reason for that is because you don't come in and just decide that I'm going to buy a widget, or I'm coming to the grocery store to get a loaf of bread, or I'm going to order a pizza tonight and order it from whoever. When you come to a hospital, typically you've got a situation where you don't really want to be there, but you're sick, and you've got to get help. So,
yeah, but I've heard that argument, but it is the truth. But again, any reasonable individual is going to say, one day I will be sick, or one day my kids might be sick. So you do the same thing on insurance.
You hope so.
You don't plan for your house to burn down, but you do buy insurance in case it burns down. Well,
let's think about 300 folks across the state of Mississippi. Many of them are working that can't afford insurance, so they put it off till the very end. They put it off. They can't wait any longer, and they wind up in the emergency room. So your cost goes up.
All right.
If you start, let's go a little bit further on that though. If you start looking at a free market, and that, just a definition of that, okay, is supply and demand. If you've got a limited supply and high demand, the price should go through the roof, wouldn't you think? I mean, in most cases.
I understand that we got one more segment. I'll talk to you about that. But the other part of that too is the free market guy I'm thinking of. Is if your business plan's not working and you've occupied every possible bed, every possible service, and the business plan is not working, then over the period of time you go back and you look at it and say, well, what's one thing that we haven't done? And that one thing we haven't done is allowed competition and capitalism to play out, because you still have a kind of a socialist template in there. So certificate of need would bring competition, but in the same manner, and we'll talk about this when we come back, The National Hospital Association has filed a lawsuit trying to stop transparency in prices being put forth coming up in January. We'll give you your time coming up next with these things. Okay, continue your free market.
All right. Good. Thank you. If we look at free market and we talk about supply and demand, you're talking about a high demand and a low supply, then your cost, your price should go way up. Well, if you compare that in the state of Mississippi and you look at nonprofit hospitals, they are the lowest cost in the country. Mm-hmm. Okay? Our government hospitals, state and government hospitals, they're at the 8th lowest in the country. Even our for-profit hospitals are the 12th lowest in the country. Well, it's hard to tell me that a free market concept is in place if we've got all these sick people and we've got a limited supply already of providers. Then why is the price not going through the roof? It's not, and we've got to say that's a Kaiser report. That's not us. That's Kaiser. So if you start looking, you made a comment a while ago about the socialized aspects of it. Well, let's talk about that a second. If you look at where we are today, about 68 or 70% of all health care is paid for by the government or a government contractor. Okay? We're getting pretty close if you want to talk about socialized medicine. Now, we've got 30% now that we have to deal with, and part of that is a 10% uncompensated care model that we talked about. That's $600 million a year for our hospitals. So, bringing competition is going to bring more unstable issues to the table for hospitals and other healthcare providers to try to deal with at this particular time. Should there be changes in CON, and that's kind of what you're getting at, I think probably there should be some modernization of the CON process and how that works. We did that about 3 years ago and actually have talked about going back to the table and say, okay, how do we need to tweak this? But somehow we got to protect those safety net facilities and providers and make sure they don't. We don't have people running busloads of competition up the Mississippi Delta. Okay? That probably needs it more than anywhere else. We don't need more competition here in Jackson. Mm-hmm. We got, other than when we got a pandemic, we got plenty of beds.
I understand. The whole thing, the whole schematic of healthcare is so wacky. It's just
it's very complex.
It's turned sideways, and we can't get it back. And a lot of that has to do with compensated care, uncompensated care, government payments, and everything else. We have in no other industry is the consumer further removed from the decisions.
Absolutely.
Than in healthcare.
Absolutely.
And one of the things that Trump wanted to do was, and again, it was the law, it's supposed to happen in January, probably will not happen. There are lawsuits, and that's to bring some type of competition through transparency to the pricing mechanism, and it may not happen now.
Yeah, and we talked a little bit about that. AHA certainly has got a lawsuit out there to try to address it. And what it does, though, is it pushes more of the responsibility back on the insurers, who actually knows what's going to be paid. Hospitals can't tell you that. They can tell you what the charge is. They can tell you what's going to be billed. But what the insurance company pays is a different model. So we've said all along the best thing to happen is, okay, let's let the hospitals do what they need to do and take care of the patient as the doctor decides that they need to be provided, and then let the insurance companies tell the patient, okay, this is what it's going to pay, and this is what you're going to have to pay. You've got all that information and all that data. The hospitals don't. They will have to fight for every dime they get. If you look right now under the MCOs, and we had this looked at just a little while ago, the amount of money, I think there was $27 million that's over 30 days old that is owed to hospitals by the managed care companies in the state of Mississippi right now. Any given 30-day period, $30 million. So that's money that is in protest that they're saying we don't owe you, but then they've got a 70% overturn rate. So they wind up getting paid 70% of the time further down the road.
And the end user is the patient who's a little bit responsible for that, because they don't care if you people are battling it out because they have nothing they don't worry about it anymore.
Absolutely. It's the first thing you learn in healthcare economics is it's a flawed system because you've got somebody providing the service, you've got somebody paying for it, and somebody else receiving it.
All we really want is the fact that to treat it like any other transaction.
Yeah.
Whether you're going to buy furniture or you're going to buy a car or whatever it happens to be, treat it the same manner. At least get it close as possible.
Yeah, and
Tell me what it's going to cost.
Closer.
Tell me when you have a window to be built in, and it's no reason we can't do that.
Yep. The only flaw of that,
even inclusive of the insurance.
You know what that piece of furniture is going to cost when you build it. Mm-hmm. When you and I go in to get the same procedure done, we're not sure what's going to happen. I may have a bad outcome.
Yeah, but then again, 6 months later, I'm getting a quote from somebody I owe a bill for 3 special nails that came out of Wisconsin.
I completely agree with that. I agree with you, Paul.
Always good to have you, sir.
You too.
Merry Christmas to you and yours.
Thank you,
sir.
We'll
get back to